Today, I will be discussing about transient ischemic attack, and we're going to attempt to define transient ischemic attack. We're going to talk about immediate management. We're going to talk about how soon we expect this patient to see the specialist, and we're going to be talking about antithrombotic therapy as well as carotid artery endarterectomy. So, to get started, what is transient ischemic attack? Transient ischemic attack can be defined as a transient episode of neurologic dysfunction caused by focal brain, spinal cord, or retinal ischemia without acute infarction. Before now, the definition of TIA or transient ischemic attack used to be based on time, but now we have gone ahead and gone forward to include tissue findings. That means if a patient is said to have transient ischemic attack, in addition to the fact that the symptoms are supposed to be resolved after a short time, there shouldn't be any form of infarction in the brain on imaging. So how do we manage transient ischemic attack? Immediate management. We need to give aspirin 300 milligram immediately. There could be some reasons why you wouldn't want to give aspirin. Number one, if the patient has a bleeding disorder or is taking an anticoagulant. Two, if the patient is taking low dose aspirin regularly. In this case, it is advisable to continue the current dose of aspirin until patient is reviewed by the specialist. Or number three, if aspirin is contraindicated, then in this case you need to discuss with the specialist team. So there are a lot of questions. There are two questions we need to ask to find out when this patient is supposed to be seen by a specialist. So the first question is, when was the suspected TIA? The second question is, how many episodes has the patient had? If the patient has a single episode of suspected TIA within the last 7 days, the patient needs urgent assessment within 24 hours by the specialist stroke physician. If the patient had the episode of TIA in more than a week previously, then the patient needs specialist assessment as soon as possible within 7 days. It is important for us to tell our patients they are not to drive until they have been seen by a specialist. Okay? What about if the patient has multiple TIA episodes in what we call crescendo TIA, or the patient has suspected cardioembolic source or severe carotid stenosis? In this case, we need to discuss the need for urgent admission or observation with a stroke specialist. Okay? Now, so if a patient has a TIA, what's the recommended antithrombotic therapy? The first line recommended antithrombotic therapy is clopidogrel. And if for any reason the patient is not tolerant to clopidogrel, is allergic to clopidogrel, or for any reason the patient can't take clopidogrel, then we go to the second line, which is aspirin plus dipyridamole. Okay, so lastly, we're going to be talking about carotid artery endarterectomy. This is recommended if patient has suffered a stroke or TIA in the carotid territory and are not severely disabled. Okay, so this is recommended if patient has suffered a stroke or TIA in the carotid territory but are not severely disabled. So in this kind of patient, we can have carotid endarterectomy. Okay. So, but it is important for us to note that this should only be considered if the carotid stenosis is greater than 70% according to ECST criteria, or greater than 50% according to MASET criteria. Now, just to expatiate, these criteria are used to calculate the percentage of carotid stenosis occlusion. And for the scope of this lecture, we are not going to be going into the details of how this is done, but we just want us to know that ECST simply means European Carotid Surgery Trialist, which is a collaborative group, and the NASCET simply means North American Symptomatic Carotid Endarterectomy Trial. With this note, we will conclude the session on transient ischemic attack, and we'll be happy to see you in our next video. Thank you.